Hello, my name is Dr. Andriana MD, and if you're watching this video, it would mean that you already know about functional medicine. So the purpose of it is really to tell you in which way my practice is different from other doctors or from other fellow functional medicine practitioners. So the first thing to say is that I am a medical doctor. I have been a general practitioner for many years, and I have been working in the national health system in the United Kingdom since 1997. The second thing to mention is that I am IFMCP certified, so there are a lot of people who claim to be using a functional medicine approach, but they can't really verify where or how they have gotten their training from. This is the reason that I chose the Institute of Functional Medicine in the United States, which is, in my opinion, the global leader in functional medicine, and have gone through their rigorous, lengthy certification process. The third point in which I feel I differ as a functional medicine doctor is in the value that I place in history taking. Now, history taking is something that is often minimized by many practitioners because of time constraints or in favor of laboratory investigations. But I honestly feel that we are more than the value of our laboratory testing, that in every patient I meet there is a person, and every person has a story to tell, and this storytelling is in itself therapeutic, especially if you consider how many people actually have physical conditions because of emotional traumas that they carry, usually developed through childhood experiences. The concept of history taking is also really important because I work with my patients in that it is very much a two-way partnership. And I believe that it's much more important to know what sort of person has the disease rather than just what disease that the person has. The final point that has to do with the value of history taking, and in order to make it time efficient, is that I use extensive intake questionnaires that the patients have to fill in. This means that I get both the full history, but we also manage to be time and cost efficient, which is very important for both myself and the patients. It is in my functional medicine training that I am able to find the clues that come from the history, piece them together, and give you the bigger picture. And as I'm sure you know, 50% of the diagnosis or the solution is made by making the correct diagnosis from the outset. And then you're able to employ the correct measures that help patients find the solution and use the solution and live the solution. So thank you very much for watching. I hope that this information assists you in choosing the right practitioner that will best serve your needs.